All right, let's continue the microbial growth, but this time we will go to the medical and laboratory asepsis. So let's go first with the definition of terms before diving into the details of medical and surgical asepsis. Let's define some key terms. The first one is sepsis, a life-threatening condition caused by the body's extreme responses to infection. It can lead to organ failure if untreated. Asepsis, the absence of disease causing microorganisms. Aseptic techniques, methods used in healthcare and laboratories to prevent infections. Sterile, completely free of all microorganisms, including bacteria, viruses, fungi, and spores. Why are these concepts important? Maintaining asepsis prevents infections. Asepsis prevents infections in hospitals, labs, and surgical procedure. So, the beginning of modern aseptic techniques. Before aseptic techniques, many people died from infections after surgery. Here are two key pioneers. Dr. Ignaz Semmelweis, that's 1840s, discovered that hand washing reduced maternal deaths from childbirth fever. Sadly, these ideas were rejected. We also have Joseph Lister in 1860s, inspired by Louis Pasteur germ theory. He used carbolic acid in surgeries, drastically reducing infections. These early discoveries shaped modern infection control practices. So, pathogenic versus non-pathogenic microorganisms. Not all microbes cause disease. Non-pathogenic microbes, normal flora, they live on and inside our bodies without causing harm and can become opportunistic pathogens if they are spread to other areas. An example of this will be E. coli. E. coli normally found in our guts that causes flatulence. But if you find them in other parts of our body, that causes LBM and other illnesses. Pathogenic microbes, these are the what causes diseases in healthy individuals. Virulent pathogens spread easily. Some cause communicable diseases that transfer from person to person. So understanding the differences helps in disease prevention and treatment. Now, next will be the types of infections. Infections can affect a specific body part or spread throughout the body. So, local infections confined to one area, like infected wound. Systematic infections spread through the body, often via the bloodstream. Bacteriemania, presence of bacteria in the blood, and septicemia, when bacteria multiply in the blood and spread to organs. So acute versus chronic infections. When you say acute, rapid onset, short duration, like flu. Chronic, persistent, or lifelong infections like HIV and hepatitis. Next will be the drug-resistant pathogens. So some bacteria evolve resistance to antibiotics, making infections harder to treat. So MRSA, the methicillin-resistant Staphylococcus aureus, common in hospital. VRE, vancomycin-resistant enterococci, often infects wounds and urinary tracts. MDR, TB, multi-drug resistant tuberculosis, resist first-line TB treatments. Now, why is this a problem? Drug-resistant infections prolong hospital stays and increase healthcare cost. Overuse and misuse of antibiotics contribute to resistance. So, prevention, proper hygiene, plus controlled antibiotic use. So, medical asepsis versus surgical asepsis. Both types of asepsis aim to prevent infections. but they differ in approach. In medical, sterile technique, clean. Okay. So medical asepsis or clean technique reduces the number of microorganisms used in routine patient care. So example, hand hygiene, disinfecting surfaces. The other one is surgical asepsis, sterile technique. Eliminates all microorganisms used in surgery and invasive procedures. Example, inserting catheters, operating rooms. So the right technique depends on the situation. So medical asepsis is used in every patient care activity. So 5 key principles. Number 1, know what is dirty. Number 2, know what is clean. Number 3, know what is sterile. And 4, keep these categories separate. And lastly, fix contamination immediately. Example, hand washing, wearing gloves and PPE, cleaning patient rooms, and disinfecting medical tools. So, principles of medical sepsis: to prevent infections, healthcare workers must follow strict hygiene. So, first, perform hand hygiene before and after patient contact. 2, use PPE, gloves, masks, and gowns when exposed to body fluids. Third, disinfect patient equipment after use. Ensure a clean environment in hospitals. Stay up to date with vaccines to prevent disease spread. So, following these guidelines reduces hospital acquired infections. So, surgery, infection risk. Surgery opens the body to potential infections without proper aseptic technique. Bacteria can enter. So, risk factors for surgical infections will be contaminated instruments, improper hand hygiene, poor operating room sterility, and also strict surgical asepsis is crucial to prevent complications. So, key concepts for surgical asepsis. It ensures a completely sterile environment. So, 4 key principles. Number 1, know what is sterile. 2, know what is not sterile. 3, keep them separate. 4, fix contamination immediately. Used in surgeries, labor and delivery, and wound care. Includes sterile gloves, drapes, and surgical tools. Next will be the principles of surgical asepsis. In operating rooms, even tiny errors can cause infections. So the patient should not be the contamination source. The surgical team must follow strict hygiene. Surgical scrubs must be done properly. Recognize and prevents environmental contamination. Even a small mistake can cause a serious post-op infection. Now let's get to medical asepsis practices and hand washing. So, hand washing is one of the most effective ways to stop infection spread. When should healthcare workers wash hands? Before and after touching a patient, before sterile procedures, after exposure to bodily fluids, after touching patient surroundings. Proper hand washing can save lives. So, what is hand hygiene? Hand hygiene involves washing with soap and water or using alcohol based hand rubs. Why is it important? Hands spread 80% of infection, prevents antimicrobial resistance, and reduces hospital acquired infections. So, good hand hygiene is equal to fewer infection, is equal to safer hospitals. Why is hand washing important? Hand washing is essential because hands transfer pathogen from patients and surfaces. Pathogens multiply on hands if not washed properly. Poor hygiene is equal to contaminated hands spreading infection. So washing hands correctly prevents outbreaks. So five elements of pathogen transmission. How do germs spread in hospital? One, germs are present on patients and surfaces. Second, hands touch infected patients or objects. Third, germs survive and multiply on hands. Fourth, poor hand hygiene is equal to germs remain on hands. Contaminated hands spread germs to new patients. So hand hygiene breaks this cycle. So reasons for non-compliance is first inaccessible ability, hand hygiene supply, skin irritation, too busy, glove use, did not think about it, or lack of knowledge. How to hand wash to effectively reduce growth of germs on hands. Hand washing must at least 15 seconds and should be performed by following all of the illustrated steps in here. Okay, so to effectively reduce the growth of germs on hands, hand rubbing must be performed by following all of the illustrated steps. This takes only 20 to 30 seconds. Okay, medical asepsis practices others. Categories of environmental surfaces, clinical contact surface, and housekeeping surface. So they should be cleaned thoroughly. Select, mix, and use disinfectants correctly. So right product, right preparation, including correct dilution, right application method, right contact time, wear appropriate PPE. So cleaning recommendations, clean and disinfect surfaces using correct technique, clean to dirty, prevent contamination of solution. Don't use dried out pipes, physical removal of soil, contact time, correct type of cleaning. Sterilization, this is what we used, like autoclave, steam, gas, radiation, chemicals. Sterile technique, as you can see in here. Procedure that to keep an object or area free from living organisms. Um, Sterile field must be kept dry. Sterile clothing should look like this. So these are steriles. So you need to wash your hands first for 20 seconds before putting the sterile. And then that's it. For any questions, you can send me a message. Thank you very much.